Can both your organizations tell us whether or not you are working with other organizations to document in a more precise and legally significant fashion the violations of human rights and humanitarian law that you are observing?
So at this point, it has really been so chaotic. It has been so difficult to have regular contact with my colleagues that we're really just trying to document as best we can as we go, and we're trying also to make sure that there's some degree of a public record of what is occurring as we go. Our témoignage is always rooted in what our teams experience and what they witness directly, and this is what we're trying to share as best we can. So I know that the World Health Organization and hopefully others are really trying to track and to document as best they can. But that's sort of how we've been approaching it.
Could you tell us about, first of all, why you think a ceasefire is absolutely essential and a pause is insufficient?
Sure. Thanks so much for your comments and also for that question. First off, to say the unusualness stems from the fact that MSF generally accepts the fact of war, and then we go into those spaces and try to defend a space for humanity and specifically medical action within war. And so we're normally asking parties to conflict to respect international humanitarian law and provide that space and give us the access that we need. In this case, that space has been so crushed, so destroyed that we just are not able to effectively act and respond anymore within this context. And that's why we're taking the unusual step of calling for this ceasefire. Now, you've asked about this distinction, why a sustained ceasefire versus a kind of short-term pause. And should this pause, this 4-day pause that they've ostensibly agreed to actually come to pass, there's a very limited amount of what we think we would be able to do within that period of time. We would certainly hope that we could evacuate people. We have been trying now for almost 2 weeks to evacuate both staff and critically injured and ill patients out of hospitals and just have not been able to do that. A few days ago, we almost were able to do that and we're not. And in fact, the convoy was fired upon when we had to go back to our base. So we would hope that we could get some evacuations, and we would also hope that within that period of time, we could bring in some basic essentials, some basic medical supplies, some water, perhaps some food. But what we could not hope to do is actually start to mount a proper humanitarian response, to actually begin to restart medical activities the way that they are needed. For that, we need a sustained, because if we just expect over the next few days a resumption of hostilities, especially in the manner that they have been conducted thus far, we could not in good conscience put more people into that context and actually restart medical activity.
Given the reality that the chances of a sustained ceasefire, other than these temporary pauses that we expect as hostages are changed, is highly unlikely, how much longer do you think that your organization can continue to work in those present conditions? And what are the risks of more catastrophic outcomes in terms of waterborne diseases, cholera, malnutrition, deaths from lack of medication, etc.?
So we're already in a situation of medical supplies being depleted. Our teams have had a shortage or a complete absence of things like morphine, pain medicines, and so on. There are clear reports from our teams and others of performing surgical procedures without anesthetic because they simply don't exist. So we are at the point of a health system that has seen an increase in needs and a massive decrease in the volume of supplies. So the answer of, how long can we continue to operate under these conditions is we're already not able to operate under the current conditions. What we need is sustained access, sustained resumption of large volumes of medical supplies coming into Gaza to respond to acute medical needs, so traumas, burns, and so on. We are seeing hundreds of patients every day, but also to meet people's day-to-day needs. And that's simply not happening at the level that it needs to. On the question of risk of waterborne diseases and so on, I mean, anytime that you have people who are being forcibly displaced and you have large groups of people in a small area, which is effectively what has happened in the South, this, from a public health perspective, increases the risk of all of these things happening. It increases the risk of waterborne diseases, of the spread of other infectious diseases, and so on. That risk exists and is credible. And from a water perspective, I mean, we have heard of people drinking brackish water, drinking salty water, because they did not have any other options. That comes with its own host of health concerns and so on. So from a public health perspective and from a health systems perspective, I mean, this is an untenable situation.
With so much information, misinformation, disinformation, it's sometimes hard to figure out. We hear repeated suggestions or proof that Hamas may be actually operating out of your hospitals or certain hospitals. For those of you who are working on the ground, is there evidence of this, or are we getting the right information? How much further can we explore this issue?
So I mentioned 367 colleagues who have been working in Gaza, supporting three different hospitals before this, running a separate clinic as well, and we haven't witnessed this. We're not able to say where Hamas might have bases and where they don't, and how far away they might be from medical facilities. But what we are able to say with absolute certainty is that the medical facilities we've been supporting and working with have been running as full, comprehensive medical facilities with hundreds of beds. And in this last period of time, over the last 6 weeks, with thousands of patients, literally just lining the hallways, injured people, children, women, the people who are already in cancer wards and on dialysis. And so these were fully functional medical facilities that have now been destroyed and are no longer functioning. So, regardless of how far or close Hamas might have been, and again, we have not witnessed that at all, but regardless of how close or far they may have been, that would certainly not absolve the IDF and the other party to this conflict from their obligations under international humanitarian law to distinguish between combatants and non-combatants and explicitly to protect medical spaces.
What can you do to better protect the members of your organization on the ground, all the while knowing that a ceasefire doesn't seem to be on the agenda, despite the fact that we have this humanitarian pause in the offing? What can be done to better protect the members of your respective organizations?
Thanks so much for that question. That's been a profoundly difficult thing to manage, and right from the early days, as an organization, all of us in the humanitarian sector have a strong obligation, duty of care to our staff, and so right since the beginning, that's been a primary concern, and we've tried to get people down to the south. We were able to evacuate 22 of the 367 employees a few weeks ago, but many of them, if not most of them, really insisted on staying behind and very personally torn. Do I go to be with my family? Do I try to go to a relatively safer part of Gaza in order to be with my family and preserve myself, or do I heed my humanitarian, my medical calling and stay here and work with the patients as much as I possibly can? And so many of them have chosen the latter, but at great personal risk. And now we know that we've lost some of our colleagues because of that. So right now it's from a distance and as an organization, it is incredibly difficult to know that we have colleagues and many other medical professionals who are at such risk, some of whom are losing their lives, and be relatively helpless in terms of how much we can help them. And that comes back to precisely what we're here today for and what we're asking. We're really asking for the Canadian government, and we're doing this around the world, asking governments to put as much pressure as they possibly can, knowing that a pause, and both parties to conflict have indicated they will resume hostilities after this brief pause. So we know that is insufficient, and that's why we're really pressing for a sustained end.
With the call for a ceasefire, a sustained ceasefire, I'm just curious what that means, a sustained ceasefire, and whether you or anybody else who is calling for a sustained ceasefire has any indication that Hamas are able to be influenced to participate in such a ceasefire. We mostly think about the Israeli Defense Force, but also the reason we hear that people that Israel will not go for a ceasefire is that Hamas will not honor that, or that's one of the things we hear.
To the question, who will the parties to conflict honor this ceasefire or even the pause? But if there would be a sustained ceasefire, would they honor it? We don't know. We can't speak to that part of it. And again, I come back to the fact that it is unusual for us to make such a call and just really ask the parties to conflict to put down their weapons. We had been able to operate in this context for decades, in fact, and as of October 7th, it just has no longer been possible. There is just no space anymore. The health system has been obliterated. There's no space to provide humanitarian assistance, and it's from that reality that we're saying, hey, put down the weapons. And the reason why it's a sustained ceasefire is, again, I come back because if this isn't sustained over a long period of time, we will not be able to get back in there to start restart the medical activities. Yeah.
Are you in contact with Canadian authorities, with the Canadian government, and what can Canada do to better protect the members of your respective organizations?
Yes, so we are in regular contact with the Canadian government. We've quite honestly been making a number of public statements to try and bear witness to what it is that our teams are seeing. So we are sharing updates regularly, very much focused on the humanitarian situation. As we've mentioned, this is a crisis where the global community needs to be calling for a ceasefire and pushing for sustained humanitarian access. Canada as a country, as an influential country with a seat at many different tables, needs to be pushing for this. Really, ultimately, what we need is assurances of safety for our staff and for our patients, and sustained access to be able to bring in medical and humanitarian supplies, but also to be able to rotate our teams who are working. I mean, it is our intention to provide medical care when the conditions allow for it and to scale up a humanitarian response. So continuing to push for those conditions to exist is what countries like Canada need to continue to do.